did this early because I know this is the next one.
Okay.
Now when I go to color it, I don't have to keep reading. What page is your what is it?
Oh, I don't know.
I did go in here. Right there. Right off.
All right, good morning. We'll continue on with lower extremity. We're at the hip joint. So I'm going to zoom in on the hip joint right there. The hip joint is the head of the femur and the acetabulum. That's what you see there. And I want you to know some of the ligaments that hold it in place. Head of femur and acetabulum. It's a ball and socket joint, and we call it most joints are synovial joints. And the movements of the hip, most of the movements we'll talk about when I get to the muscles include flexion or extension, of the hip, or you could say of the thigh, because that's the region that's moving. So I'm going to highlight a flexor here. I want to show you flexion. So when you bring the, what I don't like about this, and I'll complain to the maker, they don't show you one thing, they show you two things. Not only are they showing hip flexion, what's the knee doing? The knee's flexing. At the same time, the hip is, knee is flexing, I'm sorry, okay, well, basically hip and knee are flexing. How I would show it is, look at me. I would just bring my whole lower extremity forward. That's hip flexion, okay? But if I do this, I'm flexing the hip and the knee. And students always get mixed up on flexion and extension, so that's why I kind of have a problem with it. Anyway, let me show you hip extension. There's a muscle that extends. That's a little better. When you bring your hip backwards, we call it extension of the hip. Okay. The other thing you can do is abduction, adduction. Of hip or thigh. If I bring my hip straight out this way, what have I done? Abduction and then adduction. I think you guys need to practice in the mirror. I think that's the best way to learn is to be kinesthetic about it. Get rid of this. Maybe during lab time you guys can practice. The other thing, we'll talk about a lot of muscles that rotate the hip. You have medial or lateral rotation of the hip or thigh. Okay? And it's the same as the shoulder. So from the anatomical position, you can't see my feet in the back, but if I turn my foot out this way, which rotation is that? If I turn it out, it's lateral rotation. But if I turn it back in, that's medial rotation. And some books also use the terms, instead of medial, they say internal rotation. Or instead of lateral, they say external. And those are the main movements of the hip we'll talk about. Now, to keep the hip stable, there's a lot of connective tissues that surround it. So I'll zoom back in. And if you use the app and you build the connective tissues, the first layer, they just show you the synovial membrane. The synovial membrane makes that, is a capsule, and it secretes a synovial fluid. So there's fluid inside there to keep it lubricated. Put the second layer on. Let's see, it's a third layer. That's basically a articular capsule. That's not really a ligament, I want you to know. But if I throw on all the layers, the extracapsular ligaments that I want you to know include pubofemoral ligament, highlighted in green. Well, anyways, as I go through them, if you see it, you should be able to name it, because the ligaments are named for what they attach to. Okay. So this one's pubofemoral. Meaning it goes from the pubic bone to the femur. So it's kind of in the front because it's on the pubis. The biggest one on the side is the iliac ligament, iliofemoral ligament, highlighted in green. You can see it in the front, and it wraps all the way around. You can even see it from the posterior aspect there. So you get a nice rotation there. Again, iliofemoral, you can see it in the front, highlighted in green, and then you can even see it in the back, highlighted in green. Iliofemoral. And the last one posteriorly is ischiofemoral. So there it is, highlighted in green. You can see it from the posterior view. It goes from the femur to the ischio. Ischiofemoral ligament. And there's also a ligament deep inside the joint. It's intracapsular. It's called the ligament of the head. So to show you on the app, I'm going to use the Discover tool. It's a pretty cool tool. What it does is, wherever you tap, it's not working now, of course. Hold on a second. Oh, there it is. So you see that circle I'm dragging up and down? So when I drag over a spot, it lets you see deep structures. So I'm going to leave it right there. Okay, and I'm going to hit done. So it's a window inside the joint capsule. The ligament I want you to see is right there. I highlighted it in green. It's ligament of the head of femur. It's right on the tip of the head. It's one I haven't even been able to show before until I started using this app. And even then, well, what it is the head, at the very tip of the head, there's a ligament. And it's right on the tip of the head, holding it inside the acetabulum. Okay. And sometimes I've had the experience of having to actually remove a lower limb from the hip joint. And I have to tear that ligament. Okay. And when you do so, it leaves a little avulsion in the head. Anyways, it's called ligament of the head. So know those 4 ligaments of the hip. And I want to now move on from hip bone to hip joint to the femur bone. And I'm going to turn off that tool. Remove discover. Turn off the ligaments there. And isolate the femur bone. I'll show you the surface features using the coloring pages I provided. All right, so that's kind of the femur bone on the coloring pages. Here's the bone on the app. I haven't taught it yet, but let me just see if you know. Is that anterior or posterior? That's anterior. So if I turn it around, that's posterior. Okay. Notice posterior, you can see those big knobs at the end, those condyles. That's the front. Put back in the whole body. That's the femur, the big bone, your big thigh bone, basically. Oh, let me go to our box of femurs here. Give me a second. Sorry. This is my favorite femur. Of this whole box, this is the one I like the best, simply because it's the biggest. Well, anyway, it's a big bone, huh? Your height is about 4 times your femur length. Longest, strongest bone. It's the bone of the thigh. Let's remember, in anatomy, the thigh is the region between hip and knee joint. And, like I said, you can actually approximate someone's height because the femur is 4 times femur length. So what I'm writing is 4 times femur length approximates one's height. So the basic parts, you start with the head, approximately. Head of femur. Well, we just got through saying it, that is what fits in the acetabulum. I don't need to write that again, but the shape of it is about 2/3 of a ball, of a spear. Color it here. It's right here. Okay, so that's the head, pretty obvious. Head of femur. Now the head of femur has a little divot at the very tip. It's called fovea capitis. So when you remove the femur from the hip joint, you tear that ligament of the head and it pulls a little bit of bone out of it. So that little depression is the fovea capitis. Fovea means small depression. Capitis means it's in the head. Capit. So anyways, I'll tell you where to look for it, okay? Because you can't really see it on my drawing here. In the lab, I left a little divot here. Look for it right there. Fovea capitis. A little divot in the head of femur. Okay. After the head, you have neck. And the neck of the femoral neck is right here. Color green. The femoral neck is prone to fracture. It snaps. Many times people refer to a hip fracture as a fracture of the femoral neck. Prone to fracture, particularly in the elderly, and when I talked about osteoporosis. A fracture of the femoral neck is known as a hip fracture. Okay, so you got head, neck, and these big trochanters. Trochanters are these big knobs proximally, a lot of muscles attached to them. There's greater and lesser trochanter. Greater and lesser. Trochanters. That's 2 structures. If I do the greater one first in blue, let's say on this one, pretty much big knob right there. So that's a posterior view. I should probably label this. This is the posterior view. And this is the anterior view. Anyways, on the anterior view, you can also see the trochanter. I would say right here. The lesser trochanter, I'll use orange here. The lesser trochanter is on the inside, it's more medial. So maybe like right around there. That's from a posterior view. Anterior view, you can see that little knob sticking out. The trochanters are for big muscle attachments, okay? Like glutes, rotators of the hip, hip flexors. We'll go through them. Anyways, just note them for now. Be able to identify them on a femur bone. My favorite femur, this big knob is the greater, with the little one more on the inside. Lesser, greater, lesser. Yeah, there's a nice. The reason why it's my favorite femur is very muscular, fit people will have very definite surface features because the muscles pull on them better. So the features are more pronounced. Let's see here. Okay. The gluteal tuberosity is next. Still on femur. Well, it's called gluteal. Do you think it's going to be anterior or posterior? Posterior. Still on femur. Gluteal tuberosity. I mean, obviously, one of the glute muscles attaches there. Gluteus maximus inserts there. If you look at the posterior view, there's a rough raised line right about here. But that's probably why I put the tape if I'm trying to get you to identify that surface feature. Okay, gluteal tuberosity. If you look right down the shaft, right in the middle, posteriorly, there's a line called linea aspera. So, a couple of muscles attached there. The short head of the biceps femoris originates there. And muscle called adductor magnus inserts there. What do you think that muscle does? It adducts. Okay, well, we'll get to it. Adductor magnus adducts, but it inserts on linea aspera. Okay, so it's that line going right down the back. It's kind of continuous with gluteal tuberosity. So I'll just go. Let's see. It's all the way. Good enough. Just a green line down the back. It's kind of a double line. Well, yeah, just kind of study your own femur. Just a huge raised line on the back because the muscles inserting there or originating there. And so the linea aspera is right down the shaft posteriorly. And then when you get distal, it's a very smooth triangular shaped surface called the popliteal surface, or popliteal surface. So for linea aspera, I call it a green. And next is popliteal surface. You know, the popliteal is a word that describes a region, back of the knee. Okay.
I have a question.
Yeah, go ahead.
Linea aspera, do you find the anterior part? No.
Oh no, this is posterior. Posterior only.
Only.
Yes. And also, only posterior is the popliteal surface. Think of it as posterior knee, specifically posterior distal femur. It's basically triangular shape. There you go. Now that's an important surface because there's a major artery on the back of the knee called popliteal artery. Well, there's also a big vein, a big nerve there too. On that surface, you'll find structures in this region. Popliteal artery. You'll see popliteal vein, and a couple of nerves. When we get to nerves, you need to know the tibial and the common fibula. Those nerves are two divisions of sciatic. Well, let me just list them for now. I'll show them to you later. Tibial nerve, common fibular nerve. Those are two nerves that you see on that surface. And we'll go through the nerves later. I'm going to stick to bones right now. So know that surface. The popliteal surface is on the back of the knee. So when you get down to the end of the femur there, you got the big old condyles. Medial and lateral condyles. You know, I'm looking at that. Let me extend my blue zone all the way down. I'm going to go all the way down to here. popliteal surges. And then you have medial lateral condyles. They are basically those knob ends of the femur, and they're widened to articulate with the knee. Okay, so they're important for knee articulations. Widen for knee articulations. I hear students mispronounce anatomy structures all the time, but I've never heard anyone say knee. That would be the first. I think you guys know that one already. Well, we'll talk about knee articulations in a second here. Medial. Okay, let's orient myself. You notice how the bone slants in? Your femurs kind of curve in. They're not straight up and down. Well, because if they were, how would you walk? You wouldn't walk, you'd waddle, wouldn't you? Like a robot? Or a duck? Because your hips are wide, so the femurs kind of slant in. They're trying to approximate your body center of gravity. So when you walk in a straight line, there's a part of your gait called the swing, where only one leg is on the ground and your other leg swings forward. So your extremities have to be angled in a little bit. So they're kind of illustrated like that for a reason. So who would have a more, females, because they have wider hips, would have a bigger angle. It's actually called acute angle, and it's been measured, but you don't have to know it, the measurement. So I just wanted to mention it since they're not drawn vertically, right? They kind of slant in one way or the other. I just thought I'd mention that. Okay, medial condyle. So this is medial on this side for this bone. So that's the medial condyle.
Is that why the females waddle as they're further along in their pregnancy? Because their hips spread open a little more?
I don't know. Do they waddle? I haven't heard that.
Yeah.
Okay.
I mean, when you get like at the very end.
Yeah, because
you've got all that
the center of gravity. When the center of gravity gets altered, then yeah, you change how you walk.
Okay.
Yeah. All right. So that big knob, it's easy to put a piece of tape on. In the front, though, I could put it. This represents medial condyle right here. Lateral condyle. Okay, so it's lateral condyle. Okay, so on this one, I'll set that down here. Medial lateral condyles for the knee, and you also have intercondylar notch in between them. So just break down the word. Inter means between. It's in between what? The condyles. And what's in between the condyles? A notch. So, I mean, I'll just highlight a space in between the condyles there. Okay. And on this view here, I guess you can go. Actually, you know what? If I'm not going to color it on the front. You probably can see it on the front, but if I'm preparing for a lab practical and I want to go for that structure, I will put it right here on the back, between the two big knobs. Okay, so look for it back there. So look for this posteriorly. Between condyles. The humerus had condyles, we just didn't call them condyles. We called them capitulum and trochlea. Condyles that are commonly missed on the test. That's a tough one for students to remember. But on the knee, we just call them condyles. Okay. Okay. What we'll see is this notch will actually receive an eminence from the tibia. Something called intercondylar eminence of tibia will fit there in that notch when the knee is extended. Fits the intercondylar eminence. That's of the tibia bone. I'll get to that next. So after intercondylar eminence, after intercondylar notch of the femur, we have medial lateral epicondyles. They're simply on the sides of their respective condyles. So for the medial one, use red. That side that sticks out a little bit. More here. Okay, so that's the medial epicondyle. So the lateral epicondyle on the other side. Okay, right there. The epicondyles, there are knee ligaments that attach to the epicondyles. They're important for knee stabilization. So I'll get to them in just a minute here, but they're called the collateral ligaments. Collateral knee ligaments attached to the epicondyles. A few more things here. I have the patellar surface. Still on femur. Look for that anteriorly. Best way to describe where it is just to color it in. Let's see. Color should I use? I'm gonna use this brownish color here. So anyways, that patellar surface anteriorly, the patella, the kneecap, sits right on top of it. Patella, kneecaps, kneecap bone sits on top. We have those kneecap bones. You want to look for them over here. They're very small. Here's the kneecap bone, the patella. Okay, and it's going to sit right at the end. And so it literally sits right at the end on that surface. Okay. So anyways, I believe that concludes, oh no, I got one little thing left on femur surface features. It's called the adductor tubercle. The adductor tubercle, super small bump, and it's only seen well on my favorite femur. And I could use any femur, but it's shown well here. I see a very significant bump. You're gonna want to look for it. Is this medial or lateral where I'm pointing? Look at the head. That's medial. It's on the same side as the head. That's medial. That's always how I do a quick tell. Look for it right above the medial epicondyle. Superior to medial epicondyle. I put it there because that's an insertion for the tendon of adductor magnus. Tendon of adductor magnus inserts here. Running out of colors, I'll just use black. So I'm going to color in a little black bump right there. Or this one is going to be right here. So look right there on the femur bone. Okay, and that concludes femur. But the thigh bone is connected to the leg bone, right? So we got to talk about the knee. Well, I'm going to go back to the app. Talk about the knee. Just zoom in on the knee region. Look at the front, look at the back. There's patella sitting on the patellar surface. Let's talk about all the knee articulations. We'll start with the main ones. Looking at it from the back. Those are the condyles. All right. The articular surfaces of the condyles. And how I always orient myself if it's zoomed in like this, if I can see this splint bone called the fibula, that's always lateral. So if that's lateral, which condyle is that? The lateral condyle. So the lateral condyle of femur articulates with the lateral condyle of the tibia. So let's call this knee articulations. There's a few. Actually, there's 4. Lateral condyle to lateral condyle. One of tibia and one of femur. And you could just say the same thing. The medial condyle of femur articulates with the medial condyle of tibia. So that's 2, the condyles. Okay, that's 2 articulations. And notice how the condyles of tibia as well as femur are wide, for a nice platform. Okay, while I got back here, this is an articulation. Head of fibula with proximal tibia right there. Okay, so they actually call this the proximal tibiofibular joint. I consider it part of the knee. Proximal tibiofibular joint. Let's call that a third articulation. And the fourth one would be patellar surface. Right there. There's patella sitting on the patellar surface. Let's remember, patellar surface, that's distal femur. Kneecap on the front. Let's remember the major artery, popliteal artery, is on the back. That'd be good to have a major artery on top of your kneecap, right? What happens if you skin your knee? You rupture a major artery and you might bleed out. That's why it's on the back of the knee for protection. The kneecap is on the front. Okay. So those are all the articulations of the knee. Any questions on how the bones fit together? What you could do in lab is get a tibia and see if you can find a femur that is a close match, and a patella that's a close match. Some of the ligaments I want you to know. There's little fibrocartilaginous shock pads called the menisci. These little discs. Let me see what it looks like when they're isolated. That doesn't really show you much more. So highlighted in green is the medial meniscus. It's fibrocartilage that helps kind of absorb some of the shock, for example, when you're running. So you can see where it is. It's between the condyles. And you also have lateral meniscus. Called, I'll describe them as fibrocartilaginous shock pads. Between condyles. When I say between condyles, I mean like the condyle of femur above it and condyle of tibia below it. Okay. So, identify structure in green. Well, that's the lateral meniscus, right? You have your cruciate ligaments. I'll highlight one. That's the posterior cruciate ligament. This side here. We fade others.
And the arteries behind this?
Yeah, the artery. Let me show you where the artery is. That's popliteal artery right there. Okay, it's running right past there. There's a posterior cruciate ligament. So what the cruciate ligaments are doing, let me show you. Two intracapsular ligaments. That means they're inside the joint capsule of the knee. So basically, these are called the cruciates. Cruciate ligaments. Pretend this is a lateral view, side view. But I've highlighted there, this is a posterior view. The posterior cruciate ligament, let me write the term on the board. Posterior cruciate ligament, or the PCL for short. It starts on the tibia and goes forward to the femur. So maybe it starts back here and then goes forward to the femur, inside the joint capsule. And that's kind of what you're seeing there. The ACL crosses it. Why they're called the cruciates? Because cruciate means cross. Anterior cruciate, the ACL. So let me highlight it from a posterior view. You can see them pretty good from the posterior view. Here's the anterior one. Let's go around to the front. I'm going to hide patella. There's ACL in the front. There it is in the back. So what you're seeing is, you can see a little sliver of green in the back. It's kind of starting, I'll use green, starting right back here on the femur, and then it's going to go forward to the front of the tibia. So that little sliver of green in the front is the ACL. Yeah, question?
Aren't athletes prone to ACL?
Yeah, that's one that usually ruptures first. Usually a blow to the side of the knee will do it. Okay, before I mention that further, let me show you the other collateral ligaments, because in a serious injury, knee blowout, the collaterals will blow out with the ACL. The ACL is, man, if you can't, if that's ruptured, you can't make that quick cut on the playing field. Maybe you can run straight, but you can't make a quick cut. That's what I've heard. Has anyone ever ruptured their ACL? Not in one?
I've seen it.
Oh. And what are they like? What you've seen?
Well, I used to play roller derby, so they had a really hard time going laterally.
Yeah, those side-to-side movements are really tough if the ACL is not there.
It takes a long time to recover too.
Yeah, ligaments don't have very rich blood supply. That's why the healing process is so long. Okay. 49ers love to draft athletes who have ACL problems. I don't know why they have to do that. But anyways, let's see here. Okay, the collateral ligaments. There's the LCL and the MCL. I got to throw in all the layers here. Put the patella back in there. Here's one of the lateral collateral ligaments. Books are now calling it the fibular collateral ligament. It's highlighted in green. So no two cruciate ligaments and no two collateral ligaments. You can call the LCL for lateral collateral ligament, or you could just call it like this. More books are calling it now fibular collateral ligament. Same thing. You can see where it goes. It runs from the lateral epicondyle to head of femur. Let's remember the lateral epicondyle of the femur. To head of fibula. I haven't really taught you the fibula yet. Right there, that's the head of the fibula right there. So it runs from lateral epicondyle of femur, just from there to there. It's a simple ligament. It's one you can palpate because it's more like a cord. It's not like a flat thing. It's like a cord, round shape, and I always like to feel mine when I tie my teeth. You can feel it. So look where this ligament is. It's on the side of your knee. So it keeps the knee from buckling out, right? So if it's on the side of your knee laterally, if you receive a blow from the inside of your knee, it keeps the knee from buckling out. It's a tough, of the two collateral ligaments, this one's tougher. It's more difficult to rupture. I don't think you see it as much. Keeps the knee from buckling out. So the other one, the MCL, prevents the knee from buckling in. So let me go to the medial aspect of the knee and highlight it. Tibial collateral ligament. Highlight it in green. I still call it the MCL, or medial collateral ligament, MCL. More books are calling it now tibial collateral ligament. So this is pretty much going from condyle to condyle, epicondyle to epicondyle on the medial aspect of the knee, and it keeps the knee from buckling in. So this one is more commonly ruptured because in sports, for athletes, it's more common to receive a blow from the lateral side, from the outside, right? If you're like going to tackle someone. For an athlete, the kiss of death is if you plant your foot so the cleats are in the ground, and then you receive a blow when your knee is stuck in the ground. That's like, because then the knee will buckle in, okay, when it's stuck in the ground. So the worst knee blowout that they write about in the sports injury management books is called the terrible triad. Terrible triad, common cause, receive a lateral blow to the knee buckles in and structures rupture. Lateral blow to knee buckles in. And the triad means 3 structures rupture, it would be 3 injuries. Tear, rupture. The ACL, the MCL, along with the medial meniscus. The reason why you tear the medial meniscus is the MCL is kind of attached to that disc. So if you blow out the MCL, you might tear the meniscus that's attached to it. Okay, so that's called the terrible triad. And hopefully it never happens to anyone, but it does happen. It must happen frequently, otherwise I wouldn't be writing about it in the textbooks. I'm done with the knee unless there's any questions. The articulations and the ligaments you have to know. So then I want to do the leg bones. So how many bones in the leg do you see there? 2, tips in. Just like radius and ulna on the forearm, the leg is like the forearm of the lower limb. If you eat chicken wings, what's the drumstick part of the chicken wing? That's like the feet. So then the other part of the chicken wing that's less popular, it's got 2 bones in it, doesn't it? That's this for us. Or I mean, well, for a chicken, it's more like the forearm. The point is there's 2 bones in the leg. Remember, in anatomy, leg means region between knee and ankle. So remember, that's cruel. Cruel region is leg, the region between knee and ankle. And before I completely leave knee, basically the knee is a hinge joint. It can flex and extend. So know those 2 movements. Knee flexion as well as knee extension. Right now, you're all in a seated position. If you were to stand, which is it? When you stand, you extend the knee. Okay, right now, you're seated in a chair, and your knees are flexed. Okay, so those are the 2 main movements of the knee. Let's go to the. What are the surface features of tib fin? Zoom out a little bit, erase this stuff. Same as before, this picture on the right is posterior, tib fin. Is anterior. Tibia, that's the weight-bearing bone. That's the big bone. The little stick bone next to it, the fibula, that's more of a splint bone. A splint is for support. That's pretty much what it's for. There's a lot of muscles that attach to the fibula. I've heard in lectures that if you have to remove the tibia completely for whatever reason, that the fibula, with much therapy, can actually thicken to the girth of a tibia. I've heard that. Never actually seen it, but when they're both there, the fibula is just like a split. So let's do the tibia first. Tibia surface features. Well, I've already mentioned the condyles, so be able to identify medial-lateral condyles of tibia. So when you're looking at a tibia bone, do you see the little knob at the bottom there? I want to get to it. That's the medial malleolus. But I always look for that first. I'm just giving you the tips that I use. I don't care what you use. I'm telling you what I do. If I see that, I know that's medial. Because up here I can't really tell. But if I see that, oh, same side, that's the medial condyle up there. Use green. So posteriorly, I'm going to go pretty much all of this. on this side. I'm going to go pretty much all of that. So the lateral condyle, just on the other side. Okay, so the big knobby proximal things are the condyles of the tibia. Now, there's something called intercondylar eminence. I already noted it for you. I'll just list it again. It's that little knob. I'll use orange. It's a little thing sticking right up here. And on this posterior side, I drew a little knob right there. It's very subtle. So if you see any little bump that has a small piece of tape on it, right between the condyles, it's the intercondylar eminence. Remember, that fits the intercondylar notch in tibia. I'm sorry. This intercondylar eminence of tibia fits in the intercondylar notch of femur. I better write it again since I misspoke. Fits in intercondylar notch. Okay, that is of the femur. Moving on, tibial tuberosity. Tibial tuberosity, it's what you kneel on in your prayers or anytime you're on your knees. You don't kneel on your patella. You don't. It's your tibial tuberosities. Kneel on it. For anatomy, the patellar ligament inserts there. Okay. So let me continue on top and get to the bottom of the board here. Tibial tuberosity, you kneel on it, continue up here. Patellar ligament inserts here. Now, I didn't mention that ligament before. I better show you since I wrote it on the board. Go down there. See if you're awake. Identify bone. Patella. Excellent. Throw on muscles. Yeah. Boom. What's in yellow? Patellar ligament. But do you see how it's continuous with quadriceps tendon? So it's basically, I look at that and it's like one big thing. And inside that thing is the patella. Okay? So it goes like quadriceps tendon. Then you got inside of it patella, or kneecap bone. patella extends another ligament down here. Quadriceps tendon, patellar ligament. The patellar ligament is an exception. It's the one, we call it a ligament. Ligaments are, you use that term for connective tissue that connect a bone to another bone. Patella is a bone. It connects to the tibial tuberosity. It's another bone. So why did I use the word inserts? Don't you use that for muscles? Yes, you do. Because the quadriceps tendon is basically using it. The quadriceps tendon inserts on the patella, but those big quads, they actually use the patella just for leverage. The quadriceps is for extending your knee. So that's why it uses the patellar ligament. It's all continuous. Anyways, if you want, add all of this to your knee notes. This is basically knee. Okay. I do expect you to know quadriceps tendon and patellar ligament. Back on track. Okay. Yeah. Oh, that's good. Let me color in tibial tuberosity. About orange. You can see it on the front. It's a rough raised bump on the anterior aspect only, because you kneel on it. You don't kneel on the back of your knee, do you? So when I say kneel on it, you know where to look for it, on the anterior surface. Anterior. Okay, tibial tuberosity, moving on. Anterior margin. Next surface feature. I want to show you something on the app. So I'm going to switch views for a second. I'll switch right back, I promise. I'm going to zoom out. The tibia bone is highlighted in green there. Do you see how you can see your tibia bone with all the muscles on it? I mean, your shin is skin deep, right? We always bang it into desks. That's why soccer players wear shin guards. And so basically you're banging the anterior margin of the shaft of your tibia or your shins. So going back to the coloring template, well, don't look for it posteriorly. Look for a line anterior. It's an edge. Now, it's hard to draw, but it's better to look for it on a real bone. So I'm going to draw a line from here all the way up. There's no muscle protecting it. It's skin deep. It's just, I'll describe it as the anterior edge of shaft of tibia. It's really obvious to see when you get a real tibia, the anterior margin. We're going to go all the way distal to the end, and I want you to note the medial malleolus. It's your inside ankle bump. Well, let me bubble it in here. I'll use, how about medial malleolus. a landmark. That's the thing I use. I look for that. I know it's medial. And once you know something is medial, and if you can tell front from back, proximal from distal, you can tell if it's left or right. So the clues for medial and lateral are very essential if you want to not confuse left tibia, right tibia. Okay. Left and right was a big mistake on the last practical. That was missed a lot. Okay, very few students got all the left-right things correct. It's not easy, but I understand that. Okay, so I think I am done with tibia. Go right to fibula. I mean, look at the fibula. It's just a stick, but it has a head and then the other end. I want you to know the two ends, okay? I want you to know head of fibula and lateral malleolus on the other end. Head of fibula, I use red. How about lateral malleolus? I use green. Head, this part. And the other end, lateral malleolus down here, is there. The lateral malleolus is your outside ankle bone. So you have lateral malleolus and you have medial malleolus. They help stabilize the ankle joint. Lateral and, that's what it's spelled right. Lateral and medial malleoli, pluralize it, I guess, they form ankle joint. I got the foot zoomed in there so you can see the ankle joint. I'm going to erase my colorings here. So this is the ankle. There's lateral malleolus and medial malleolus. That is the, what they fit is, it's the trochlea of the talus. The talus is one of your tarsal bones. So these two, lateral and medial malleoli, they fit trochlea. There's that term again. Trochlea is a pulley. But this is a different bone, a tarsal bone at the ankle called the talus. talus is the bone, trochlea is the surface feature. We're going to sneak peek to bones on the next page of the study list. Trochlea of talus is one of the features you're supposed to know. Anyways, this forms a pretty standard hinge joint. The ankle is a hinge joint. Movements of the ankle, if you bring the main movement of a hinge is movement in one plane, okay? Like bring your feet up and down, point your toes in the air, or stand on your tippy toes, and rock back and forth. That is called dorsiflexion, plantar flexion. So that's the main movement. So I'll demonstrate that for you. Tibialis anterior is one of the muscles we'll learn later. Here's dorsiflexion. Notice what you're doing when you do that. Well, basically you're pulling your foot up, right? That's dorsiflexion. The muscle lights up when you dorsiflex. Point your toes in the air. I highlight a muscle on the back, like big old calf muscle, gastroc. That's a plantar flexor. As in standing on your toes, or when you run, plantar flexion, you push off. Another name for ankle joint is talocrural joint. Why? Why did they choose that? What's talo refer to? The talus, and crural means leg. So talocrural is a hinge joint, also known the subtalar joint. That's part of the ankle. So what joint is that? Well, basically, it's a joint underneath the talus bone, because when that moves, it allows what's called inversion, eversion of the foot. So let me show that to you. I'm going to go tib anterior because then I know that muscle inverts the foot. So see that? I don't know how you describe that. Turn foot in. That's it. You have muscles that can move that. So if I zoom in, it's the subtalar joint that's allowing that movement. Rock foot inwards. See how the bones are moving there? So I'll point to the talus. That's the talus. So you see why they call it the subtalar joint? I mean, that's what's moving, like underneath the talus bone. So it's a pretty good. The app did well there. So let me show you the eversion of the foot. Eversion. Fibularis muscles do that. Eversion of the foot. Right there. Again, turn your foot outwards. So it's like lifting the lateral aspect of your toe. You lift that part of your foot off the ground. Now you don't really do that unless you're doing some kind of dance or something. Usually what you really do is, like, if you're standing on a bus and you sway back and forth, that's really inversion, eversion in a practical sense. Okay. Anyways, that's another movement of the ankle joint. Let's move on from ankle to foot. Foot. In the foot, study tarsals, metatarsals, phalanges. That's the pluralized form of the word. The singular form of the word is phalanx. And based on the last test, many of you have forgotten that. And well, what did you write? You wrote phalange. And I let it go. Not on this upcoming lab practical. I will mark that wrong this time. So you've been warned. Fired my shot across the bow. If you want to go singular, put phalanx. Okay. Well, anyways, the tarsals are basically posterior foot. And there are 7 tarsals. We mentioned one, talus. I'll color it over here. It's right here. It's the trochlea. If you look at this, is a superior view, but that all this is like trochlea. Let me outline it here. Trochlea and talus. I'll do the whole talus here. That's all talus. Be sure to note the trochlea. Of this bone. I've outlined it in red. How about I color the trochlea part in green? It's just this top smooth pulley part right there. It's most of the bone. Yeah, I mean, maybe the coloring book isn't helping us here, but this is better studied with a real foot. You can do it in the lab time after our break. Anyways, that is the main bone that is forming the ankle, the talus. Your heel bone is the calcaneus. Color it in orange, so you can kind of see a piece of it here. That's your heel bone. Look for the Achilles tendon to insert on the back of the calcaneus. The Achilles tendon, you still see that term in anatomy books. More often they're calling it the calcaneal tendon. Name the tendon after the bone it inserts on. I'm sorry, tendon, not tendon. The Achilles tendon, as we'll see, is the big tendon of your calf muscle. The gastrocnemius soleus. We'll get there. So that's 2 of the 7. So let's do the rest. There's one bone called navicular. Someone thought it was shaped like a boat. It's the Navy. It's right here. Always remember, it's on the same side as your big toe, and they have big boats in the Navy. That's how I've always remembered over the years. Well, the one next to it is cuboid. So I colored navicular blue. The one next to it is cuboid. I'll go green again for cuboid. So right here. So that's cuboid. I just colored it in green. Then I see 3 bones right next to that in front of navicular. So far we got 1, 2, 3, 4. And those final 3 are all called cuneiforms to round out the 7. We have medial, intermediate, lateral, cuneiform bones. So that's 3. I'll color the middle one black. Then we'll go orange for medial. We'll go red for lateral cuneiform. That's the 7. And then if you go in front of that, the tarsals are kind of posterior foot, but midfoot, forming the arch of your foot with the tarsals, is the metatarsals, and we have 5. 5 metatarsals forming midfoot. And they're numbered metatarsals 1 to 5. The proper way to name it is, well, if it's a metatarsal, to put metatarsal, let's specify which one of the 5. For example, if you have to identify it, metatarsal 1. How about I color blue? Notice how metatarsal one, okay, you tell me, is metatarsal one medial or lateral? It's medial. Well, what about metacarpal one in the anatomical position? It's lateral. So it is kind of not the same for the hands and the feet. Anyways, metatarsal one, then just count from there. 2, 3, 4, 5. That's easy, right? If that's 1, then this is 2, 3, 4, 5. And then you have the phalanges of the digits and toes. For digit 1, you only have a proximal and a distal phalange. Or distal, yeah, phalanges. 1 proximal phalanx, 1 distal phalanx. But for 2 through 5, you have proximal, middle, and distal. Phalanges. Why don't I go red for the proximal ones? I'll just trace them. I'll go, how about green for middle. Notice there's no middle phalanx for digit 1. How about I go orange for distal there? So let's say it's the lab practical and I say I have that bone right there, X marks the spot. And I say identify bone. The correct way to name it, just to review that, this is also missed on the practical. First, identify the bone. Is it a metatarsal? No. Most people didn't name the bones right on the hand. So let's not mess it up for the foot. That's a proximal phalanx. Okay. You can't just put phalanx, you have to put that as proximal. Of what? Fill in the blank. What would you put? Digit 5? For the fingers, you know, most students didn't get that. I didn't see that very often named correctly. So that's the proper way in terms of the digits. Tell me the digit, but tell me which bone. Okay. Sometimes students would put proximal flange, like 4. Okay, what's wrong with this? There's 2 things wrong. One thing wrong, that's misspelled. Second thing wrong, what's IV? It's 4, but for what? Yeah, why did they put that? I was like, oh, yeah, I guess they mean digit. It could also mean metacarpal, or right? Okay, on the next test, it's like completely wrong. Okay, I'm gonna be a bigger shark, marking things wrong. If you thought I was tough the first time around, I get tougher because it's the same skill set, just a different region of the body, and I expect students to be better. That's my high expectation of you. Okay, so study the bones in the mindset that you'll have a lab quiz on bones Wednesday. Wednesday. Okay, let's take a break and come back and have a lab. Yeah.
What's the popliteal